And guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We are servicing Palm Beach County, Broward, and Miami-Dade. And our phone number is 954-717-7027. I am your host, Louise Gomez. And this is a new year. I know traditionally what we normally do at this time of year is we make powerful resolutions and intentions. And normally it's about health, Normally we want to, get back in shape, or, we want to change the way we're eating, or we want to, do something that's going to, precipitate something for our health and well-being. And, what I love about this show is we always have great doctors or, health nurse practitioners or, people in the health and wellness field that are always going to be advocating for, our health. And I think actually the most important thing is that we become our own, health advocates, and we become our best. We know ourselves better than nobody else, right? So we all know what we need to do. We all know what we need to change, and I'll speak about myself. It's always, moving more and getting more activity and, eating healthy. Those are the things that we can actually take a proactive step. That's something that we can do. We don't need a prescription. We don't need, a gym membership. We could just put our tennis shoes on and start moving and, go to the store and read labels and look to see, what can I get out of my diet? It used to be back in the day, it was all about reducing fat. I think we've come to realize it's really about the sugar, reducing the sugar. And that's really something that we can all take a step at, looking at labels and, making sure that these are ingredients that we know that we can pronounce, not, these ingredients that we're like, what is in this box? Is it a food, or is it just a product? And, back to basics, back to, think about what is it that you enjoy, what natural ingredients. I found an old juicer that I had. It's still working, kicking away. I'm using it, even if it's just my apple, my lemon, my ginger shot every morning. Little changes I feel that are just so helpful and useful for us. And I know that we all want to be able to do that. And every doctor that we've had on here, every, health practitioner and doctor, whenever they complete the show and whenever we speak with them, I always ask them, what are some tips and tricks that we can do? And it really always comes back to the basics that we already know, getting a good night's rest. How important is that? Getting your eating your fruits and vegetables, getting your exercise, reading the labels, making sure we're eating healthy foods. And as I said, these are all the things that we can do on our own without, having to even go to a doctor's office and getting a prescription for any of that. And emotional and mental health, I think that's really huge. I think, maintaining whatever it is for you, whether it's meditating or whatever practice you have. I know breath work is really a foundational step for a lot of people. And, we have somebody coming on. She's going to be logging on, Dr. Roshini Singh, and she is a national board certified nurse practitioner. She is with 365 Health and Wellness, and she's actually a mobile primary care service directly to you, servicing Palm Beach and Broward County. And her number is 561-770-8072. Thank you so much for tuning in, Dr. Singh. How are you?
Hey, very good. And do you, please, Roshini Singh. I'm a family nurse practitioner.
Thank you for thank you for tuning in. And so I know you're a national board certified nurse practitioner. You said, but you're doing mobile primary care services directly to people's homes. Is that right?
Yes, yes. And it's been an amazing experience because I feel like I can get to know the patient a lot better by being in their home environment. So it's nice. And I also can spend a significant amount of time with them compared to when I was in traditional practice. So yeah.
Yeah, I know that you were supposed to be in here in studio. You got called in because you're running around helping out the community. You had a patient to see. Is that right?
Yes, yes. Yeah, I was running behind, and that happens very often where, I have my appointments lined up, but some patients are more complex than others, and then I spend a longer time. And I thought I was going to be able to make it to the studio, but I am taking this call on my way home back to the office to do more work. That's the lifestyle, I guess.
Well,
So.
we appreciate you doing that. And I really believe what you're doing, the mobile primary care services, I really believe that is something that is so needed. And I feel that more and more of the community actually really want that. What has been your experience with your patients?
Yeah, it's been a wonderful savior for many patients, especially the ones with multiple sclerosis, unfortunate cognitive decline, such as conditions, Alzheimer's and different types of dementia, Parkinson's. So I do have a lot of that clientele where mobile primary care works very conveniently for them. So their loved ones doesn't have to take them out of their home and take them to a primary care's office. So it does work very conveniently for those types of clients. And then my other demographic are actually patients in their, the 30s to 50s where they're working,
Nice.
Monday to Friday,
Yeah.
and they need, they don't have the time to really take off and go to a primary care's office. And we work as a very convenient aspect for them and their children, because we see pediatrics to geriatrics.
Nice. So, what are your hours? What can somebody expect if they decide to work with you? What are your do you have extended hours? What are your normal hours?
Yeah, our extended hours are mainly for our monthly members that join our practice. We're very untraditional. We don't stop at 5 o'clock, as you can see. So we're very flexible and non-traditional within reason, of course.
Right.
Of course, I'm not going out to see a patient at 9 or 10 o'clock at night either. But
Right.
if one of our members text or call at 8 or 9, and they need us, and it's something urgent, I will be on the call with them.
Nice.
So it's very flexible, and we work on the weekends too, but mostly, during the week. Everything within reason, I would say.
Right. So you mentioned something about a membership. How does that work? Are you accepting insurance plans and they have a membership? How does that work?
So the insurance plans work beautifully with our type of practice model. It's called a direct primary care practice, and we actually do encourage clients to have an insurance plan with our model. So we take all insurances, whatever insurance you have, we utilize it for ordering things like labs and diagnostics. If a patient needs an X-ray, MRI, CAT scan, we do it like any other primary care office where if they need that, we bill the insurance like any office. The
Right.
reason patients are paying us this monthly fee is to have a more unique, convenient access where we're mobile, they text us, they're directly talking to us when they call. There's no waiting room times. It's just they're paying us for this higher access of care then and spending more time with them as well. I remember in traditional practice where unfortunately I didn't have enough time with my clients. It would be around, 10 to 20 minutes on average to see someone. And I felt that that was not enough time. But with this model, I can spend a longer time, really get to know them and understand them, and do the best I can to appropriately diagnose them and give them the best treatment plan because I know them better. And that's the whole
Yes.
purpose of this model and why patients pay us a monthly fee. Yes.
I feel like there's so many benefits of you going into their home. What would be some of the advantageous benefits of you going into the patient's home?
Well, one, of course, they don't have to leave their home setting. We
Yes.
schedule our appointment. They can carry on their day, and then we arrive at the appointment time. And also, it's just it's such a comfortable environment. It's a private space. They're in their own comfortable space. So I feel like patients will talk to me more about everything, and which I want to hear everything. I want to know everything because that will all matter to how I diagnose and treat someone. So that's the second benefit. Their comfortability increases their ability to just speak more on their life, which is wonderful. In general practice, I didn't really have a chance to know them
Right.
enough. So that's nice. And then thirdly, to something funny is that like I see their environment. Like
Yes.
sometimes if I have a good relationship with my fridge, I'm going through their fridge. I'm like, what's in your fridge? I
That's-
want to see what
Yes.
is it that you're buying. Let's take that Ferrero Rocher label and take it out. I want to see the saturated fat content on that and show you that that's not something you should be on with high cholesterol, whatever, So it's like I can really
Yes.
be tangible with them, and so that's cool. Yeah.
I was just thinking that, yeah, you get to see their lifestyle. You get to see if they have some vodka bottles under the table or.
Oh my gosh.
And
I've
it's,
seen that. I've walked into a patient's homes where they have a cabinet of alcohol, and of course, I mean, alcohol is definitely it's fine within
Sure.
reason. Of course, I'm not a stickler and going to tell the patient they can't have alcohol. It depends on the situation, but it really does tell you a lot. Like when you see certain things, of course. Yeah.
oh, absolutely. So, can you tell us a little bit more? Well, first of all, I wanted to congratulate you because I know you were on CBS Channel 12 News and they interviewed you. So congratulations to you on that.
Oh my gosh, thank you so much. It was very, very, very last minute that it was brought to me on that exact same day, and it was a wonderful opportunity, and I'm so grateful. And thank you. It's so nice that you saw that. So thank you.
Yes, absolutely. Can you share with us a little bit more? I think maybe you were speaking about the Protect Our Loved Ones Act here in Florida. What is that all about? Can you share with our listeners and viewers a little bit more about that?
Yeah, so it's a bill that just got passed on the 1st of this year, literally, and they wanted to notify, civilians about this new law, and it really is what it means: protect our loved ones. Okay, with psychological conditions, patients with, for instance, autism, Down syndrome, or patients with Alzheimer's or various types of dementia.
Right.
If law enforcement was called on these patients, let's say they were doing something against societal view, we're going to put it diplomatically that way,
Yeah.
And law enforcement was called on one of these patients with psychological conditions, that law enforcement will have this registry, this list that, oh, this person pops up and it shows their diagnosis, of course, submitted by a medical provider to
Right.
show that, in fact, indeed, they have this condition. So now that law enforcement officer can appropriately, do their job, understanding that this patient has this psychological condition. So it's a registry where you, as of right now, that loved one, that parent or guardian or partner enters their loved one with the psychological condition into the registry. And that's what it's about. Does that all make sense?
Yes, absolutely. And I think it's so
Yeah.
important because there's so many different, anything from mental health challenges to, like you said, maybe Alzheimer's or, dementia or whatever the case is. I feel it's so important for the professional, the police or whoever's called, to really have that background information because it really is what it says. It's really protecting our loved ones so they can appropriately know how to deal, since they're the professionals, right? How to deal with that particular challenge. So I'm
Yes,
grateful for
absolutely.
that.
And a big, a, right, absolutely. And a big thing is, I was saying on the interview that, if we have more understanding of people and what they're going through, then you can yield positive outcomes. So I was definitely for this bill, and it's going to only bring positivity, is what I said on the interview. So more understanding of what's happening in people, it's just more beneficial. How many times we have dealt with things that we don't understand and we get frustrated very
Yeah.
quickly because we don't understand, just a simple example. If we understand more about a human and what's going on, then we can deal with things more appropriately.
Yeah,
Period.
and have compassion, and I think that's what it's all about, having
Mhm.
compassion for all the different, needs that we all have as humans. We all have different needs. So that's really I'm grateful for that. I'm glad they did that here in Florida. So
Yeah.
yeah, I was going to also ask you, because a lot of people are curious. So when you go to a patient's home, what are you walking in with? Like, are you able to, you know, let's say they needed their blood checked, or I don't know, whatever. What is
Yeah.
your scope of tools that you walk in with?
Yeah, no, for sure. Good question. So yeah, I have this big bag and I have lots of goodies, and depending on what the case is about, I'll walk with appropriate things. Like, let's say I know that I need to do an EKG today, I'll bring that with me. If I know that we will be doing blood work, I bring all the phlebotomy supplies with me to draw labs on site. I do have a couple of staff members that are medical assistants and phlebotomists that are out, that will go to the patient's homes to do these tasks, or I'll do it myself when I'm at the appointment, especially for like an annual physical. So
Right.
I'm coming in with those tools and also the basic tools that we need in any medical practice to check your vital signs and to do a head to toe assessment, just like you would as a physical exam in a primary care's office. Of course, what we can't offer being in the mobile setting, going into patients' homes, like is for example, like a pap smear then, because that will
Sure.
entail more of a different setup.
Right.
But most of our patients will see their gynecologist for that. But
Sure.
everything else we pretty much can do in the home setting.
That's amazing. I feel that, that's what more and more people, I think after COVID, I'd say that's what more and more people are wanting. Because people were just like, oh, I don't want to have to go
Yeah.
out, and I don't want to have to, go to
So
wait in a doctor's
I'm
office
glad.
for hours.
I'm
Go ahead.
Oh my gosh, I'm glad you said that, because that's why our practice was created. Because I noticed that patients were not coming into the office as much to do their routine checks, whether they have diabetes, high blood pressure, high cholesterol, asthma, COPD, renal disease. All these types of patients need, checks at least, let's say, every 3 months to ensure we're practicing preventative medicine. And they weren't coming in as often because of COVID. So then I researched it up and I'm like, okay, well, we can do this mobile. It is possible to provide effective, safe,
Yes.
appropriate care in the home setting. So we opened up in April of 2021 after, research was done, and I believe we were the first mobile primary care practice that is utilizing the direct primary care model in Palm Beach County, I believe in the county so far. So I believe we are
Congratulations.
the first when we first started. Yeah.
So you are in Palm Beach County. Any other counties that you go to?
Right now, we're just Palm Beach County. I mean, I
Okay.
do have a few patients that we'll see in Broward County, but most of our patients are in Palm Beach County. Eventually, I'm hoping that we do extend into Broward and Miami. That will be later down the line. But right now, our focus is in Palm Beach County.
I think I read an article that actually insurance companies are liking this medical model actually because the traditionally a lot of people just run to the OR if they have a problem, and I think what you're doing has helped them to reduce the rate of which patients just run to the OR. I mean the ER, the emergency room. And so you're helping your model is helping decrease the rate of which patients are just running to the emergency room for routine things. Maybe, I say routine, but maybe they're not feeling well and they have a, bronchitis or they need a
Yeah.
prescription and they're running to the emergency room for that. So I think your model is being looked at as a very positive thing because of that, decreasing that.
Yeah, and I'd say the main reason that it's positive in that regard and reducing those ER visits is because of higher accessibility. The client has higher accessibility to get through to their practice quicker. And it's because we have less patients, and also we do not utilize insurance to earn. So we're not worrying about billing and coding, and we have to do things a certain way. The patients pay us a monthly affordable rate. And when they call, or no copays, they call or they text or we get on a call or we see them in person. There's no copays. There's no finagling around an insurance system.
Right.
So that reduces the time and gives that patient more of a direct access to us. Patients will text us all the time. I mean, if I know my clients are family, and I know them and they text me, I have urinary frequency or burning urination, or I have a cough or whatever it is,
Right.
random things. I already know them and I'm getting on it right away. I'm texting them back, asking them symptoms. I'm like, let's get on a video call. That reduces the need for them to go to an urgent care or an emergency room visit unnecessarily. But of course, if they're texting about something that's like, for instance, chest pain, then I'm not going to text. That's ER. So some things obviously is going to
Sure.
warrant the ER visit, of course.
Right. Of course. I always like to ask, our professionals if you have any success stories of lifestyle changes, of people actually maybe, doing what you recommend and having some success stories of maybe exercising more or dropping some pounds or I don't know, whatever you consider to be a success. Do you have any of those?
Oh yeah, no, of course.
Can you
It's
share?
so many because the beautiful thing is that we're able to spend a longer time to counsel them through it,
Yeah.
and really be their support system, and check on them more often via text call, phone call, because we have just more of an access to reach our patients. And holding them accountable.
I like
So
that.
yeah, we've had many clients where on a weekly basis, sometimes I'm texting them. I'm like, what's going on? What did you do this week? I'll have patients that send me their Apple Watch snapshot
Oh, nice.
of like, here's my current target heart rate and this is what I'm doing right now. And I'm like, this is so amazing. Like, I love that they are keeping in contact with me and they're following the recommendations and we're giving them that support. Now, it's not
Yes.
perfect all the time, even though we spend time with clients and we
Sure.
try to counsel as much as we can. It's not perfect. So I can't say all patients will follow it.
No, of course.
But, I
But
mean, it has improved. Yeah.
so we have 2
Yeah.
minutes left. Do you want to share with
Okay.
us? It's in these next 2 minutes. It's that time of year, New Year's resolutions. What do you suggest for us to get? To really say this time this year, I'm gonna create my resolutions and stick to them. What are some good suggestions you have for our audience to help us really do what we say we're going to do?
My biggest suggestion is, and I tell all my patients this, almost every day I tell them this, I'm like, set realistic goals. Do not try to rush and do a gym routine 7 days a week right off the bat. Start slow. Start once a week for the next 2 weeks for 30 minutes. Then you're going to move it up to twice a week for 30 minutes after that, and etc. Like 3 to 4 times a week of walking. Brisk walking has been proven success in weight loss and for your bone health and for your mental health and everything. So I always counsel my patients, listen, just walk for 30 to 40 minutes, 3 to 4 times a week, and get on that routine. And you feel so good. You feel accomplished that you've done something.
Yes.
And like, what's 30 to 40 minutes out of your day to plan around and do that? It's not a lot. When you put it in perspective for the client, it's really attainable. It's an attainable goal.
Yeah.
And also, weight loss goals are not 30 pounds in 30 days.
Right.
They might be 4 to 6 pounds in a month. And that's
Right.
a huge accomplishment. I tell clients, do not beat themselves up when they haven't lost a significant amount of weight in a month. Give yourself time. It's a lifestyle change.
Yes.
It's forever. So make these realistic changes that are going to last a lifetime. And that's my advice.
Thank you so much for that. And that's the key word, realistic, because it is a lifestyle change that we're looking to obtain. Thank you so much for your time, and have a healthy and happy new year. And thank you so much. Anybody who wants to get in touch, I'm going to give you Dr. Roshini Singh's phone number, 561
Just Roshini Singh.
I'm sorry?
Just Roshini Singh, not doctor.
Oh, yes, I'm sorry. ARNP, a National Board Certified Nurse Practitioner. Yes. 561-770-8072. They can call or text, and check out the website, www.365healthwellness.com. Thank you so much for your time, and enjoy the rest of your evening. Take care. Bye.
Thank you, Louise. Still happy to be here. Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422